Hello, my name is Mario Kaywood, and this is my campaign addressing high blood pressure. High blood pressure, or its medical term, which is hypertension, is usually diagnosed when your blood pressure is pumping blood at an abnormal rate. Some various methods that you are able to have high blood pressure can be attributed to obesity slash inactivity, smoking, sleep deprivation, and diet. The demographic I wanted to reach out to were adults, mainly because as an adult, you're able to be in full control of your lifestyle, whether it be exercise and diet. So that's why I chose to have adults instead of children, mainly because when you're a child, you are basically only able to eat the foods that your parents are given. And then also, since high blood pressure is not attributed to any specific age range or race or gender, I chose to use this as my campaign because it was a more broad topic, and this can apply to anyone. And according to the CDC, 47% of the United States population currently has high blood pressure, and included in this statistic, that includes people who knowingly and unknowingly have high blood pressure. Other risks that are associated with high blood pressure are stroke, heart disease, cardiovascular disease, and death from multiple causes. And this means if you have high blood pressure, you're at a higher rate of having the diseases listed below, and if you were to have multiple, you're at a higher mortality rate compared to just only having high blood pressure. So reducing your numbers can greatly improve your chances of not having any of those listed below. This chart basically shows a breakdown of multiple races between the males and females, and it shows a breakdown of the races between males and females in between all the races. And one statistic that I would like to point out is that according to the CDC, males are 50% more likely to have blood pressure compared to women. Okay, reduction and control. Some tips to reduce your chance of having high blood pressure, or if you already have high blood pressure, these are also applicable to you too. Exercise and dieting, stress reduction, and limiting alcohol. Okay, so exercise, it basically helps your blood to pump at a higher rate, but it also clears out a lot of toxins that may be in your bloodstream as well. Dieting, we try to stay away from as much fatty and processed foods as possible because those typically are the foods that clog your arteries and can be attributed to high blood pressure. Stress is another factor. So similar to exercise, you release two chemicals that are similar in exercise and in stress. And one of them is adrenaline. And in the case of exercise, it is being released and it is being released out of the body, whereas stress, it mainly stays in the body and causes your blood pressure to skyrocket without having any chemicals to release out of your body. And then alcohol and smoking, when you consume alcohol and are smoking, it narrows out your blood vessels, which ultimately will increase your chances of having high blood pressure because your blood has to pump at a higher rate to push blood through those smaller blood vessels compared to an active person who has more wider blood vessels to be able to push the blood out. Conclusion. Ultimately, having high blood pressure comes down to lifestyle. For For those who do not have high blood pressure, I would suggest taking the necessary steps to reduce the chances, because ultimately it will increase as your age increases. So finding healthier dining options, maybe not taking strenuous exercise or activities, but maybe including walking or smaller exercises will drastically help you to reduce your chances, as well as cutting out carcinogens such as smoking and alcohol can greatly improve your chances of not having high blood pressure. But ultimately, it comes down to each person's decision and conclusion. So ultimately, high blood pressure comes down to lifestyle choice. So for those who are inactive, have a bad diet, and chooses to indulge in smoking and drinking, have a higher chance of having high blood pressure. But for someone who's trying to reduce their chances, I would suggest maybe cutting out alcohol or and smoking, or reducing your consumption, in addition to increasing your exercise levels and choosing healthier options if possible. That way, your numbers will decrease when it comes to chances of having high blood pressure. Thank you.